Now let's look at how do excess body fat and diabetes promote cancers, right? So there's a very simple illustration on the left-hand side, which basically says too much body fat triggers inflammation. Inflammation is where our immune system is on an overdrive, not against an external virus or a pathogen, but because it thinks that there are some pathogens inside our body, right? So our immune system stays high, and that is basically termed as inflammation. Chronic inflammation is bad for us. It promotes cancers. Acute inflammation, which is as a result of fighting a virus, is great, right? That's how we overcome viral infections. But chronic inflammation is bad. So too much body fat triggers inflammation, also triggers something called oxidative stress, which basically means these fat cells in the body, they produce free radicals. I'm sure you have come across this phrase called free radicals. These are reactive oxygen species, right? I won't go into the chemistry of that. I know we have some chemistry teachers here. You can bother them separately. But these reactive oxygen species, they do something called, you can think of it as, they corrode proteins in our body, right? And that corrosion of proteins in the body in the form of, let's say, the enzymes getting corroded, that can also trigger genetic mutations, which can turn into a tumor or a cancer. Inflammation also causes our pancreas to produce more insulin. More insulin makes us insulin resistant. Insulin also promotes the growth of more fat. So it's a vicious cycle, right? These fat cells also make estrogen, which I'm sure all of you know as the hormone. Men also have estrogen. The challenge is, both in females and in males, when we have too much estrogen because of too much fat in our body or because of too much insulin in our body, that high estrogen levels promotes cancers, right? And we'll again see how that happens. Too much insulin and estrogen cause cells to divide more than usual. That can then, just from a chance perspective, in other words, from a stochastic perspective, that can turn into cancerous tumors, right? So what is also important to note, there we go. What is also important to note that there are multiple factors which cause progression of cancer. Hyperinsulinemia, which means too much insulin, is a factor. Insulin-like growth factors, which cause these cells to divide and multiply really fast, they also promote these tumors, right? Similarly, dyslipidemia, which is high cholesterol, high fat, or high lipids in our blood, as well as adipokines and cytokines, which are basically inflammation markers, right? All of these cocktail of chemicals in our body, triggered by excess body fat and triggered by diabetes and insulin resistance, promote cancers. Like I was saying earlier, fat, which is around the middle part of our body, is the most harmful when it comes to these biochemical processes, right? If you have fat in your legs, if you have fat in your arms, which is typically the case in the West. So if you're a Caucasian, if you're a white American or a white European, you tend to be overall big when you are obese. As Indians, on the other hand, we tend to put on more of this so-called visceral fat, which is the fat in our middle section of our body, which is the fat which is inside our viscera, around our organs like our stomach and our intestines and our liver, right? That fat is the most dangerous fat. So the graphic which I'm showing here basically shows the two gentlemen. They are both researchers in the space of diabetes. They came out with seminal research in the 1970s and 1980s. On the right-hand side is Professor C.S. Yajnik. On the left-hand side is Professor John Yudkin. you'll see that their BMI is identical, 22.3. They both have the same body mass index. Yet, Professor Yajnik has a body fat of upwards of 20%, whereas Professor Yudkin, a British researcher, only has 9% body fat. And you can see the difference. Professor Yudkin looks overall big because he has fat around his arms and legs, whereas Professor Yajnik actually looks thin, which is what most Indians look like. We all look, this is called the thin fat Indian, right? We all look thin, but we have a lot of visceral fat, right? That's what puts us at an even greater risk versus rest of the world. Now that we know that this is heading for a disaster, what can we do, right? Well, we can reverse the root cause of excess body fat and diabetes, which is insulin resistance and inflammation. We need to stop worrying about all of the symptoms, which is, oh, my weight is high, my waist size is high, my glucose levels are high, my BP is high. We have to think about the elephant in the room, which is we have to reverse the root cause, that is insulin resistance and inflammation, right? How does it all start? It all starts with what we eat. 4 specific foods trigger these biochemical processes which cause excess body fat and insulin resistance. What are these 4 different foods? Number 1, and the primary culprit, added sugars without the fiber, fructose. Fructose is the sugar that we derive from fruits. The problem is when we eat fruit, that is perfectly healthy because nature has packed the fruit sugar with the fiber, which protects our liver. Fiber protects us. The challenge is we have now refined that fruit sugar and we, without the fiber in the form of table sugar, we add that in excess in every food, right? We buy bread from the supermarket that has added sugar. We are eating sweet yogurts. We are drinking Coca-Cola and Pepsi. We are drinking fruit juice thinking they are healthy, right? But fruit juice does not have fiber. It only is left with sugar. So added sugars are the number 1 culprit. Number 2, branch chain amino acids, which are found in refined protein powders like whey protein powders, as well as all of these packet protein powders, right? We tend to think they are healthy. They are not healthy. Branch chain amino acids do the same thing to our liver that added sugar does. By the way, it is also found in red meat and dairy and poultry, right? Number 3, trans fats, which are found in dalda, hydrogenated and reused oils. When we use the same oil again and again for frying, it turns into trans fats. Trans fats are also found in bakery, meat, again, dairy and poultry. And last, alcohol, right? So by now you've already developed a mental map of what is it that you are eating during the day, which is making you vulnerable to all of these risks, right? This is the biochemistry in the when we eat these 4 different foods. You can see fructose on the top left of the page, right? When our liver is overwhelmed with fructose because we are eating too much added sugar and we are not eating it with the fiber, all of these biochemical reactions take place, which causes inflammation in the liver. It causes IR, hepatic IR, which means hepatic or liver insulin resistance. It causes muscle IR, which is muscle insulin resistance, which, by the way, later causes high glucose levels in the blood because our muscle cells are not able to take in glucose from the blood, right? Because of their insulin resistance. It also causes free fatty acids in the blood. It triggers lipid droplet formation in the liver. Lipid means fat. It triggers basically buildup of fat droplets in our liver. When our liver becomes too fatty, it has to export that fat in the form of VLDL, which I'm sure you've heard of as the bad cholesterol. It exports that fat into our bloodstream, which is how we get high cholesterol. And then all of that fat in our blood goes and gets deposited in our fat depots in our body, which is how we get obesity and high triglycerides. And lastly, it also causes high BP, high blood pressure, which is the most important risk factor for cardiovascular disease. So the point I'm trying to drive at here is when we eat these 4 different foods, not only are they making us more vulnerable to cancer risks, they are also making us more vulnerable to diabetes, to dyslipidemia, which is high cholesterol, and to high blood pressure. And all of these can also trigger a heart attack or a stroke later, right? What are some of the additional inflammation risks? Well, no points for guessing the fact that smoking is a huge inflammation risk. Saturated fats, which are present in uh, butter, which are present in dairy, which are present in red meats, are also an additional inflammation risk. Omega-6 fatty acids, right? So sunflower oil, sesame oil, peanut oil, they are rich in omega-6 fatty acids. Refined carbohydrates, which is why we are always hearing that maida, right? Bread, maida, these are not good for us. Endocrine disrupting chemicals. For example, if you're heating your food in plastic containers, stop doing that, because these plastic containers, they leach chemicals into the food, which disrupt our endocrine system in the body. And lastly, stress and poor sleep are also additional inflammation